So I'd like to thank Dr. Narsingan for arranging this program, for inviting me. And I know it's a very prestigious meeting arranged under the auspices of the World Hypertension League. And I also know that I think next year the international conference will be held in Chennai. Great pleasure and honor to finally catch up with Dr. Paul Welton, about whom I've been hearing so much in the last few years. And nice to share the podium with Dr. Prabhakaran, Dr. Chandrasekhar, Dr. Kannan, and of course Dr. Anil Parikh, my good friend. So I'm not a hypertensionologist or a cardiologist. In that sense, probably I'm the odd one out. But we do have some data on the metabolic non-communicable disease in India, and that's what I'm going to present to you in the next few minutes. I have no conflict of interest to declare. This study was completely funded by the Indian Council of Medical Research and the Ministry of Health, Government of India. So what is this ICMR India Diabetes Study or INDIAB Study? Till we started the study in 2008, we had numerous studies on, the focus of course of the study was on diabetes, and that's why it's called as the Indian Council of Medical Research, ICMR India Diabetes Study. But we did more than diabetes, as you will see. So until then, we had regional studies. We had some studies in Chennai, something in Delhi, maybe something in some villages, one or two odd villages here and there. But we really didn't have national data. We didn't even have a state data. Not a single state in India had been studied completely for any of the metabolic diseases. When we first proposed this to ICMR, we meant it to be a small study, north, south, east, west, because India is so big, as you know, 1.44 billion people. We are the largest country in the world now. We are bigger than China. So when we started this, we had proposed we'd study one state in north, one in south, one in east, west, and that's what we proposed to ICMR. Actually, it's my daughter's idea. She kept saying, all your research is Chennai based and it's no good, we have to do India, and so on. But we went to ICMR and they said, if you're going to do a study, you have to do the whole country. Because in India, health is a state subject. While the policies are laid down by the union government, each state looks after its own health. So he said, you can't do one state and leave another out. Either you do the whole country or you don't do it. Believe it or not, it took us 15 years to complete this because we were looking at representative samples of each state. And as you know, each state in India is bigger than a country in Europe. For example, Tamil Nadu is bigger than the whole of UK. And UP is probably, if UP, Uttar Pradesh, a state in India, if it was a country, it would have been the fourth largest country in the world. Just after the United States comes Uttar Pradesh as a single state. So it's a massive exercise. And of course, it's the largest epidemiological study ever done, not just in India, but in the world. We did publish a few papers halfway through because it was so big that we couldn't wait for 15 years. So 4 or 5 years ago, we published, when we finished 17 states in India, we did publish it. But this is the ultimate report, which is published in Lancet Diabetes on June 7th. And just to give you a feedback of what happened on this June 7th, midnight, it was published. It was almost June 8th. On June 8th, when the new numbers came out for India, and I'll just show it to you in a minute, the old number was 72 million. Suddenly, overnight, it's become 101 million. We had phone calls from the Prime Minister's office and the Health Minister's office. And the best was, and they were saying, what should we tell people? I mean, they're going to tell us, how do we manage this? And what do you tell us? So I gave them the speech. I said, we have got that also prepared. So this is what you say. And they were very relieved that they could, talk to people. The best was BBC. So BBC called us and said, India is finished. Oh, you have too many people with diabetes, hypertension, it's a disaster and India is over. So we said, no, if we can do a study to this effect, we can even manage it. So just leave it to us, we'll manage our own country. Thank you very much. So then the guy put down the phone. So that's how the impact that the study has made. In every conference I go, I'm very happy that this study gets quoted. So let's look at a few of the statistics from the study. Now this is the weighted prevalence of diabetes in the whole country, urban, rural, and overall. Now, urban is not just Chennai, Mumbai, Hyderabad, Bangalore, not the metropolitan cities. It includes tier 2 cities, tier 3 cities, anything which is urban. And that itself is 16.4% of the whole of urban India. And rural India, which had a prevalence of 1% about 40 years ago, is now almost 9%. And remember that the rural population of India is almost 800 million. 770 million, something like that. So even a 1% increase there would mean a big jump in numbers of both diabetes and hypertension, as you will see. And the overall prevalence is 11.4. So if you take the whole country, all adults about 20 years, this is about 20 years of age, it's already 11.4%. Now this is just to give you a pictorial representation of urban India and rural India. You may wonder why Jammu and Kashmir is in white. That's while we are doing the study, the state got divided. And so we are currently doing it. We've just finished actually. Jammu, Kashmir, Ladakh, Leh has been finished. We are also finished Andaman, Nicobar Islands. We finished Lakshadweep. We finished Daman and Diu. And the rest of it, what is left out, has all been completed now. Just this month, it will be all completed. But if you look at the urban India, what is shown in red is about 10% diabetes. Almost everything is red except UP, which is slightly lower, thankfully, but UP is also going to increase in the next 4 or 5 years. Rural diabetes is still, if you look at the hinterland, the Bimaru states as we call it, there's still a lot of green there, which means the prevalence is quite low. There's a sharp socio-economic divide. So South India, which has a better socio-economic status, has more obesity and more diabetes. Now, that's diabetes. Now and this is just to show you that the prevalence of diabetes varies from 4.8% in Uttar Pradesh to 26.4% in Goa and almost 25% in Kerala. This is what my daughter had told me, that you cannot generalize studying one state in India. There is so much of heterogeneity. Unless you study the whole country, you will not be able to get the proper. And she was right, because you can see the huge difference. And these have been adjusted for time, because you may say 15 years ago it was low. We've done all that. The statistical analysis all been adjusted for that. So there is a huge increase, and the states which have already reached there will probably level off. It's not going to keep on going. You don't get 100% diabetes anyway, somewhere around 20-30%. But then these ones will then start moving up. And therefore, the number of people with diabetes, hypertension in India is going to go very, very high in the years to come. Let's talk about pre-diabetes. Pre-diabetes, remember the diabetes prevalence, it was 11% overall. Pre-diabetes is 15%, okay? And there's no urban-rural difference. There we saw a huge difference, urban and rural, as far as diabetes is concerned. Pre-diabetes is no difference. There's equal amount of pre-diabetes in rural India. Now that's bad news actually, because if the pre-diabetes numbers are low, it would mean that the epidemic is getting over. We don't have to worry about it. If the pre-diabetes numbers are larger than the diabetes numbers, it means that they are all going to convert into diabetes shortly. I'm not going to go into it, but we have data to show that South Asians and Indians have much faster conversion from pre-diabetes to diabetes than the white European population. So that's the other thing, that not only we have a lot of it, but you're going to convert very fast. Now you remember the lot of green that you saw in diabetes in rural. Look at that. It's red already in rural as far as pre-diabetes is concerned, which means those states which you saw green will not be green if you repeat the study after 5 years. Pre-diabetes is there and is going to convert into diabetes quite soon. Hypertension, of interest to all of you. Now the earlier studies which had been done from India had shown hypertension rates which were in the range of 25%, 28% and so on. What we found in INDIAB is that the rates were actually much higher. 40% of urban India has hypertension, almost 4 out of 10. And in rural India, it was 33%. So if you include both together, the overall prevalence of hypertension in India was 35%. That means 1 in 3 adults has hypertension. This is much higher than the earlier reports, which were 25, 28%, one or two had reached 30%. But this is now showing a prevalence of 35%. And again, if you look at urban and rural, you can see that, of course, urban has much more hypertension, but rural is not far behind. And very soon in rural India also, we'll have a lot of hypertension. Obesity. There are two types of obesity, as you know. One is generalized obesity based on body mass index. Now, the cut points for obesity in India and South Asia is different from the West. So we take, this is the WHO cut point. So, and anybody with a BMI above 25 is considered obese in South Asia, in Asia, and in India. So using that cut point, about 40% of urban Indians, 23% of rural Indians, and overall about 28% of the whole of India, if you take adults in India about 20 years, have generalized obesity. Now wait till you see the abdominal obesity. Now that's generalized obesity. Urban, completely red. There's no urban area in India which doesn't have obesity. Of course, we use the Western cut points, it'll be much lower, but then they're not appropriate for our country. I'm sure Dr. Maleshwari and others will agree with that. Rural, not so much. There's still places where there's not so much of obesity, but the rate at which India is progressing, the GDP is progressing so fast that it won't be green for very long. 5 years later, 10 years later, all that's going to turn red. Abdominal obesity. Half of urban India, 52% of urban India is abdominally obese. Now, what are the cut points there? 90 centimeters waist and above for males, 80 centimeters and above for females. I know that in the West it's 102 centimeters, 104 centimeters for men, but these are the internationally accepted cut points for Asia, South Asians, for Indians. These are all WHO cut points. So rural India, we thought was very lean. Well, there are some states which are very, very lean, but overall, if you take India, it's 33.5%, and if you take overall urban, rural combined, abdominal obesity, almost 40% of all adults in India have abdominal obesity. And these again tell the same story, completely red in urban, with a few patches not showing red in rural. Dyslipidemia. I'm not going to show you the whole thing, but we all know that we have a very low HDL cholesterol. That's very well known. As Indians, as South Asians, we have the lowest HDL cholesterol in the whole world. We still don't know why, whether it's genetic or whether it's due to the high carb load that we eat or lack of exercise or a combination of this, but that's very well known. But if you just look at hypercholesterolemia, defined as a cholesterol level above 200 milligrams per deciliter, a quarter of urban India and 22% of rural India has hypercholesterolemia, and overall about a quarter again have hypercholesterolemia. Of course, these are very different in some states. For example, you look at Kerala, coconut oil, look at Goa, and look at Punjab, where a lot of ghee and butter is eaten. The cholesterol levels are about 30-40 milligrams. Kerala and Tamil Nadu, if you compare, the mean cholesterol level is about 30-40 milligrams higher in Kerala compared to Tamil Nadu. Now, these are the final numbers of the metabolic NCDs in India. 101 million people with diabetes, 136 million people with pre-diabetes. Of interest to this audience, 315 million people, that's almost the population of the United States, is the number of people who have hypertension in India. And then 254 million with generalized obesity, 351 million people with abdominal obesity, and hypercholesterolemia, and 213 million. I'm not showing you triglycerides and low HDL and high LDL. We have all that data in the same paper. Okay. Now, just coming to, we looked at in another INDIAB paper, we looked at whether we are achieving the A, B, C, D goals of diabetes therapy. And I know Dr. Prabhakaran is the audience, and he told me, why are you using such loose criteria? Blood pressure 140, 90, is that the blood pressure that you want in people with diabetes? That's not what I want. I want much, much lower. I'm looking at what India has achieved. So I'm using, if I use 130, 80 or 130, 75, nobody's going to achieve in India. So I'm using very loose criteria. HbA1c of 7 is not even enough. You have to get much lower. but are we at least achieving the A, which is A1C 7%, blood pressure 140/90, LDL we only use 100. We not use 70, 50, 30 as you want. We're just using 100. How many have achieved LDL of 100 in India? And then of course, the D includes diet, exercise, no smoking. We didn't even include D in this. We just did A, B, C. How many have achieved A, B, C in India? Now, that sounds very easy, but are we achieving it? Now, this is another paper, again in Lancet, where we looked at the people with self-reported diabetes. So, the whole country, everybody who told us that they already had diabetes, they're already going to a physician. That means they should have achieved these goals. They're not newly diagnosed. We didn't go and pick them up. That is separate. We don't expect them to be controlled. If they're diagnosed yesterday, how do you expect them to be controlled? These are people who are already self-reported. They're taking treatment. A, B, C. How many have achieved? And here's A, B, C. A1C less than 7%, blood pressure 140/90, LDL 100, and so on and so forth. So that's green. Remember the color. Satisfactory is if they don't achieve that, and poor, of course, A1C is 9%, blood pressure is 160/100, LDL is 130 and above, and so on and so forth. Okay, it's all there in the paper. That's the whole country. Alphabetical order, all the states, from starting with Andhra Pradesh, it was undivided at the time. After we started the study, Andhra got divided into Telangana and Andhra. So from Andhra Pradesh up to West Bengal, we have every state in India, and what we have data is A1C, systolic blood pressure, diastolic blood pressure, LDL, HDL, and then we also have triglycerides, and we have smoking, alcohol, fruits and vegetable intake, and physical activity. And you saw the green, the pink, and the red. Just look at the HbA1c, the second column. There's not a single green. Not a single state in this country, not even Kerala, not any state in India, Tamil Nadu, nowhere is the mean A1C at 7% in people with diabetes. Similarly, look at blood pressure, lipids. Lipids little better. Actually, there are some of them, because we used 100, at least some of them have got it below 100. Go to the last column, and there's physical activity. Okay, and how much have we asked for? 150 minutes per week, 30 minutes a day, 5 days a week. Do you do physical activity? And these are people with diabetes. Okay, the red shows that in no state are people doing physical activity, which explains abdominal obesity, by the way. Okay, so the situation is not good as far as NCDs in India is concerned. We've got a lot of work to do in diabetes, hypertension, dyslipidemia, all these we have a lot of work to do. This is just a kind of summary. If you look at diabetes, about 30%, the blood pressure about 50%, and cholesterol, LDL about 60%. But if you take all the three together, A, B, and C, what percentage of people in India with diabetes? Now, these are not clinic attending patients. They are not people who come to you and to see me when they have very bad. We have gone to their homes, representative sample of India. This is actual India state of control. So if you see A, B, and C with those loose criteria, so that's why Dr. Prabhakaran, we used 100, because even with 100 LDL and blood pressure 140/90 and A1C of 7%, only 7% of Indians have achieved. If you had tighter criteria, it would have been 0% or 1% or something, very depressing. So we have got lots of work to do as far as control, and that's why meetings like this become very important. So that is, in a nutshell, ladies and gentlemen, the ICMR India Diabetes Study. It's a compendium of metabolic NCDs. We are not done yet. We still got so many papers to come on diet and more on physical activity, the correlation with oils and heart disease and so many things. I invite all of you to join us. If you've got ideas, you've got such a big database, 124,000 people on whom we have so much of data collected. So if any of you have any ideas, INDIAB doesn't belong to us, it belongs to the government. So we would be more than happy to participate. So on that note, thank you very much for the patient here.